Hi everyone, it's Raewyn Teirney here. I'm a fertility specialist with IVF Australia, and I've been very privileged tonight to speak to you and talk with you about polycystic ovarian syndrome. So it's wonderful to have you here, and please ask me any questions anytime as we go through polycystic ovarian syndrome. Now, I've been working as a fertility specialist now for the past 20 years, and I've certainly seen a lot of women with polycystic ovarian syndrome. So tonight, hello Julia. Tonight I would like to firstly go over a little bit about what polycystic ovarian syndrome is, just to give you a bit of an overview. And then we can talk about some of the symptoms or side effects that you might be having when you've got polycystic ovarian syndrome. And I want to touch on some of the really good fertility options that are there that can help, boost your chances of getting pregnant with polycystic ovarian syndrome. Some people call it PCOS, some people call it Pcos, and some people say the whole word polycystic ovarian syndrome. I usually say PCOS. But look, let's get started. And please hello Benazar. Please ask me any questions, and because if you have questions then and I answer them, I'm pretty sure other women or men who are listening in would probably have those same questions as well and would want to know those answers. So what is polycystic ovarian syndrome? Well, it's a very common endocrine disorder that we see all the time. It's worldwide. You're not alone if you do have this. It's about, when you look at the incidence, it's between 5% and up to about 13%, depending on the study and where you are in the world. So really, it's almost like 1 in 10 women, up to about 1 in 5 women have this disorder or disease. And when I mention it's an endocrine disorder, it's a disorder where there is a hormonal imbalance inside your ovaries, leading to infrequent ovulation. And because of the infrequent ovulation, it leads to irregular periods. So many women have infrequent periods or even no periods at all. Another aspect about polycystic ovarian syndrome is because of the hormonal imbalance, there is higher male androgens or male hormones like testosterone within the ovary and floating around in your body, and this can lead to symptoms such as increased hair growth, such as hair on your face or on your back, on your arms. You may have noticed this. You may even be noticing increased acne. This is another side effect of having raised hormones as well, raised male hormones. When you have these raised male hormones, there's also a possibility that will affect what we call egg development inside the ovary, which will then lead to poor egg ovulation and lack of ovulation and infertility. And this might be you, which is why you're listening in today. And I want to reassure you that you're not alone. Infertility and ovulatory infertility, this is infertility where women do not ovulate, is actually one of the most common, PCOS is one of the most common causes of anovulatory infertility. And there are many treatments that we can have to help you conceive. All right, so let's get started. Look, are there any questions at the moment? Okay, something here. Okay, Julie has asked, hi, Dr. Teirney, what are the risks of PCOS and IVF treatment, and when should I ideally start my treatment? Okay, so if you've got polycystic ovarian syndrome and you're wanting to get pregnant and you're thinking, well, what are the treatments? Well, yes, IVF treatment is one option that you can take to help you conceive, and it certainly gives you a higher chance of getting pregnant. I will be talking later about other fertility treatments, but IVF certainly is a good treatment for women with polycystic ovarian syndrome. Now, we usually offer IVF treatment to help PCOS women conceive in situations where there may be other issues happening as well, like there might be a male factor with the partner and his sperm issues, or there could be blocked tubes. And if there's blocked tubes, then of course we need to go on and perform IVF rather than the more simpler PCOS fertility treatments. Other reasons why we might do IVF is because we've tried the simpler treatments and they just haven't worked, and so IVF would be the next step. or it could be that when we've done ovulation induction to help women ovulate and too many eggs might grow. And I've seen this often. In fact, I just had a beautiful patient today who had quite bad PCOS, and we went through the whole gamut of fertility treatment and eventually had to do IVF treatment because every time we tried something simpler, she kept growing too many eggs, and the last thing we wanted was to make her into the octuplet mum, and so we had to move to IVF to put one embryo in at a time, and she's now got 2 children from that procedure. Look, there are risks. So if you're PCOS and you're going to be doing IVF, yes, there are some risks to you. With IVF, the whole idea is that we give you hormone injections to grow your eggs. This takes a couple of weeks, and then we would go in and then we remove your eggs with a surgical procedure that takes about 20 minutes. Now, when we give you those hormones to grow your eggs, one of the risks is that you might develop too many eggs. When I mean too many, we'd like to get about 10 to maybe 18. With PCOS women, sometimes we might get 30, and there's a risk of something called ovarian hyperstimulation syndrome. So this is, Julie, one of the risks that might occur with IVF treatment, but we do watch you very closely, and there are things that we can do just to prevent that as well. But ovarian hyperstimulation syndrome is one of the risks. I think one of the other risks is when you do IVF, sometimes we might find that with the eggs that we collect, some of the eggs might be what we call immature because you have so many eggs inside your ovary. But I think OHSS, ovarian hyperstimulation syndrome, which is a condition where we get too many eggs in IVF, and you can end up in hospital on a drip for a few days and in pain. But that is one of the risks. Now, I've just got a question here which asks, what about the possibility to do, let me have a look, looks like gender selection. I suspect, gee, I've been asked this question a lot lately, gender selection here in Australia. For a family of 3 daughters, congratulations, and all via cesarean section and removal of 1 ovary. I'm sorry about that. But look, just to give you an idea, in Australia, this is for all couples who are doing fertility treatment and IVF. Can you do gender selection? The answer is yes and no. And so you can't do gender selection when there is just for a family rearrangement. If you've got, 3 daughters or 3 sons and you want to have, a son if you've got 3 daughters. So unfortunately, you cannot do that for, a family situation. But you are allowed to do sex selection in scenarios where there might be something related to the X or the Y chromosome. So just say if your child has autism quite badly, there's autism in the family, and we know that's linked to the males, then yes, you can do gender selection and have girls, or if there are other genetic conditions that might be linked to X or Y chromosome, then you can select the sex where you're not going to have that genetic problem. But so I think the upshot is that no, you just can't ordinarily select a boy or a girl in Australia. All right. Look, I want to get back to specifically polycystic ovarian syndrome, and I just want to talk a little bit about some of the things that you should be doing when you're trying to get pregnant. And one of the sort of things that you're doing is actually one of the first line treatments to help women get pregnant. And this is looking at your lifestyle and trying to modify your lifestyle, getting your weight down, looking at your diet, eating a very healthy diet where you're having a diet rich in antioxidants and reducing your carbohydrates and eating mainly complex carbohydrates like grains, whole grains, and wholemeal bread. And so changing lifestyle is very important because this may help you ovulate and conceive naturally. Another aspect to helping you get pregnant is there is now, and this is something new in polycystic ovarian syndrome, is that they've done a lot of research and looking at what are the best fertility treatments in polycystic ovarian syndrome women. and it goes through what we call a cascade. And at the top of the cascade is what we call lifestyle management and changing your lifestyle, which is of course easy to do, isn't it? I mean, we've all had trouble trying to lose weight and changing our lifestyle. But then the next step would be going on what we call oral agents or oral tablets. And these are tablets to help induce you to ovulate. And there are two tablets, but what's new is that research shows that the best tablet to start, and I start my PCOS ladies on this medication, and it's called letrozole. I think other places around the world they might call it Femara. And this is a tablet that we use in breast cancer, but it's also been shown to be excellent for inducing your egg to grow and ovulate. And so this is the first line treatment for helping women with Pcos to conceive. There's also a tablet called Clomid. I don't know if any of you have heard Clomid, but we've been using this for many years, possibly over 30 years, and it is very effective as well. And we can use this instead of letrozole, but letrozole now has been shown to be the best tablet for the job to help women such as yourself ovulate and conceive. And what's good about this tablet is it's a really low cost. You might be only paying $30 for it for each month. And so it's not expensive, and it's actually a really simple treatment to use. So this would probably be your first line treatment to help you get pregnant. We know that it helps women ovulate about 80% of the time. So there's a group of women that it won't work on, and then women where we can't help you get pregnant with the oral tablets, the next step would be moving on to things like injections, follicle stimulating injections, FSH. And these are called, in the long medical term, gonadotropins. And these injections, we give you a daily dose. And what they do is they induce your egg to grow. So this time they act on your ovary and they stimulate your egg to grow, and then we would trigger your egg to then ovulate. And why are we doing all of this? Of course, we want you to ovulate to then have timed intercourse to hopefully get your egg and his sperm to join, fertilize, and then create an embryo to hopefully implant in your uterus. Now, look, I've got some more questions here. Okay, so Benazar has just asked, it was a great question, Benazar. Many women ask this as well. And is there any relation between polycystic ovarian syndrome and miscarriage? You know, how can you ensure to avoid one and have a smooth pregnancy? It's a very common question. Just to give you an idea, miscarriage is common anyway, whether you have polycystic ovarian syndrome or not. For all pregnancies, so women who are pregnant, the risk of a miscarriage is on average about 20% per pregnancy. And so just so if you had a miscarriage, then the next time you conceive, the chance of you going on to have a live baby is 80%, again with that 20% chance of miscarriage. Does PCOS increase your chance of a miscarriage? What we do know, we used to think yes, and we thought possibly it's hormonally related, but in fact we think the association of polycystic ovarian syndrome and miscarriage is actually related to our weight. And so we know that a lot of women with polycystic ovarian syndrome have a much larger body mass index, so are heavier, and weight has, we know that the heavier you are, certainly there's a greater chance of complications for pregnancy, and miscarriage is one of them. And so, Benazar, yes, there is a relationship between PCOS and miscarriage, but we think, this is what we think, and some of the new evidence that's coming through is that it's more weight related. And if a woman can get their weight down to a healthy body mass index, then certainly you and they will be reducing the chance of miscarriage if you can do that. But there are other reasons for miscarriage, and if you are concerned, then certainly there are tests that we can do as doctors for women who are miscarrying. And I suggest also, speak to your doctor about that, and they can organise those special miscarriage tests for you. Look, I've got another question here. the lovely Catherine. Hello, Catherine. Hi, Dr. Teirney. I have a question actually unrelated to PCOS, and this is on endometriosis. Okay, look, sometimes PCOS women have endometriosis too, so I think all these questions are relevant. So, how much does removal of improve IVF rates? Or fresh embryo transfer rates, and are there any good studies since 2011 on this? Okay, well, look, there have been studies years ago that showed that removing endometriosis from mild endometriosis, superficial, which is mild endometriosis from women, helped improve chances of pregnancy, and in both naturally and yes with fertility treatment. Are there more recent studies? The problem is the studies aren't good. And the reason for that is we can no longer get those studies through the ethics committees. So ethics committees around the world now have refused those sorts of studies. So we can't randomize women anymore and looking at that. All we can do is look backwards and look at women who've had transfers of their embryos and see did they have endometriosis or not, and compare it that way. With superficial, look, the answer is out. We still don't yet know. With a fresh embryo transfer, yes, older studies show that there was some benefit. This is my recommendation. I would think, because laparoscopy is a big thing to do and it's not without risk, Catherine. If you're not getting pregnant, just say if you're doing IVF and you have nice embryos and yet you're not getting pregnant with those embryos, and we're concerned that you might have endometriosis or you have a history of endometriosis, yes, I think it might be worthwhile then going in and surgically removing that endometriosis as an option. However, if it's just sort of a general laparoscopy to see if you've got endometriosis anyway and you don't have any symptoms, no, I wouldn't recommend going in and having a look with a laparoscopy. I hope that answers your question. Let me go down and have a look if there are any more. A lovely question from Violet. Hello, Violet. Very good question. I'm a single woman. I see single women all the time. I do, to help them conceive. So with PCOS, and you're about to start ICSI, and you had your eggs harvested, 34 of them, which, yes, that's a lot. And you're right, that is a lot of stimulating and overstimulating. And how will my PCOS affect my implantation? Well, Violet, certainly does PCOS affect your implantation? Implantation, so the chance of an embryo, which is the chance of an embryo implanting into your uterus, is actually mainly related to, one, your age. So this is the biggest factor, is actually your age, Violet, compared to whether you have PCOS or not. So age is a bigger factor, and also quality of the embryo. So if the embryos that are formed by day 5, if they get to a blastocyst, if they have a poorer quality look, then they're probably less likely to implant, whether you have PCOS or not. All right. Does PCOS still affect my implantation? What we do know is when you have a lot of eggs, so like 34, in your case, when you have a lot of eggs, we know that sometimes those eggs can be poorer quality. And if you start with poorer quality eggs, then certainly you could end up with poorer quality embryos, which may reduce implantation. But no doubt a lot of those eggs might still be very good quality, but we know that when we have a lot of eggs, there'll be a real variety of quality in those, and the poorer quality eggs, when you have a lot, may end up with poorer quality embryos, possibly. But PCOS itself, no, we don't shouldn't affect implantation. However, remember I mentioned about your body mass index and weight. So if you're someone, which we know is related to PCOS, so if you've got a higher body mass index and your weight is larger, your weight is likely to affect implantation. So it's not the PCOS per se, but it's things that are associated with PCOS, such as your weight. Yes, if you get lots and lots of eggs, the egg quality could possibly be poorer, and also your age. So age is the biggest factor, okay, for everyone to. This is really a take-home message with implantation, that female age is a very important factor, okay, in implantation and getting pregnant, naturally and with IVF. Let's have a look. So hello Blaze, hello Celisa. Um, oh, and Catherine, and you meant frozen embryo transfer rates. Okay. Look, yes, it would be much the same with fresh. All right. Hello, Tori. Thank you for joining. Now, Sophie's got a question here. Hi, I'm breastfeeding my first baby, 9 months. Congratulations, Sophie. And I'm planning my next frozen embryo transfer. Great. I will be using HRT as I did with my first baby. I haven't got my period back yet. Should I wean my baby or continue breastfeeding as I'm doing HRT? Yes, with my frozen embryo transfer. I know my milk supply will start to drop with HRT. Yes, so I'll always get my ladies to slow down their breastfeeding. It depends on what your plan was and how long you're wanting to breastfeed. It would certainly be good to see if you get a period or a couple of periods before starting your HRT, and this means hormone replacement therapy, ladies. And so when we do a frozen embryo transfer, sometimes we give a hormone replacement therapy to women, especially PCOS women, to help the lining and prepare the lining for implantation of the embryo. And so, Sophie, yeah, I would probably, depends on when you want to wean off your child, but wean off slowly and see if you are going to get periods prior to starting your HRT. Speak to your clinician as well, but that would be my recommendation. Aprilla also has a question. Aprilla, thank you. Hi, doctor. Can Clomid be prescribed after I complete 6 cycles of letrozole? I've completed 4 cycles at the moment without success, but I'm ovulating. Aprilla, don't give up, all right? The fact that you're actually ovulating on this very simple treatment is good, all right? Now, the reason why we have 6 cycles is, and we use that 6 cycles, that we only want women to have 6 cycles of treatment. It goes back to a study years ago, and there was a very old study. It was a poor quality study, but back then this is what we use, and it showed that women who are on Clomid, so the study was women taking Clomid because we didn't have letrozole back then, and we found that women who were on 12 months of Clomid or longer had a slightly higher chance of breast cancer. And so as a consequence of that, the recommendation was to only have a maximum of 12 cycles of Clomid. And this is obviously sort of been passed on to letrozole. So if you are on letrozole and you haven't got pregnant despite ovulating, can you then go on to Clomid? Well, we don't have any studies on that, so I'd recommend speaking to your doctor about that. Yes, it's a nice, simple treatment. If you're not getting pregnant on this Clomid and you're on letrozole and you're ovulating, I think it would be good, just make sure, speak to your doctor to make sure you've had all the fertility tests and completed them all, making sure that the sperm's okay before going on to like Clomid, making sure your fallopian tubes are fine. As well, before proceeding on to another oral tablet. The other thing too, Aprilia, is your age, and so sometimes we only use 6 months because if you're not getting pregnant by 6 cycles of letrozole, and you should, if you're ovulating, you should have had about a 60% chance of conceiving on 6 cycles of letrozole. So if you're not getting pregnant, we think, okay, maybe we need to move on to the next step. And the next step when women who are not getting pregnant on the simple treatment are the follicle stimulating hormone injections, FSH. And these are injections that you take daily to grow your egg, and we trigger ovulation. And you can either do it with timed intercourse with your husband, or we can do what's called intrauterine insemination, where we get your partner's sperm and we actually put it into the uterus right on ovulation. And again, we recommend a couple of goes of that, and then finally, if that doesn't work, then IVF. So there's a sort of a treatment cascade. But I think, depending on what your age is, if you're over the age of 35, or if you're 35 and over, if you complete 6 cycles of letrozole and you're not pregnant, I would recommend moving on and not going to Clomid. Grace has got another question on letrozole. Hi Grace, it says, with letrozole, is there a way to tell if the eggs are developing fully? Good question. There are a couple of ways to tell, yes. When we give, as doctors, when we give letrozole, which is, an ovulation inducing agent, we tend to track you. And here at IVF Australia, if any of you ladies are interested, we do have one bulk build cycle tracking that we can do to help track you and see if your eggs are developing fully and if you're ovulating. So normally to know this, we would track you, and this would be with a blood test and even a scan, and we would also track you after ovulation to see if you have ovulated. And this is with a progesterone hormone blood test, and if it's elevated, it has told us that you have ovulated, which meant your egg would have developed and ovulated. So I hope that's answered your question. Hi, Pernia. Thank you for coming on and listening as well. Now, I'm going to move on. And Violet, the lovely Violet, beautiful name. Now, Violet, you say, I understand about a healthy lifestyle with PCOS. We all do, don't we? It's just very hard, trying to do it. I control my PCOS weight through a lot of exercise, but have been told that that will compromise my ability to get pregnant and carry through with the first trimester due to changes in the hormones. I'm just going to say a little bit more about what you wrote there. It's like too much testosterone, blood flow, etc. My doctor said I need to drastically reduce and stop my exercise routine. I'm worried about that what will happen to my PCOS body, and I'm scared that my weight gain will occur. Yes, I understand that. And do you know of anyone in this situation? Yes, I know hundreds of ladies in your situation. Definitely, that's a common question. So it depends how much exercise you're doing. Firstly, your weight is really important when it comes to getting pregnant with PCOS, very much so. And by keeping your weight down will help with you ovulating. Okay, depends on how much. So a lot might be if you're obviously a marathon runner and running, or exercising, 4 hours a day. Yes, that would be a lot of exercise. So it depends what you're doing. I do see athletes coming through with PCOS, and if you're ovulating, so if you're doing all this exercise but you're still ovulating, then your amount of exercise is okay to continue. All right, so it's okay to continue. When you're pregnant, doing this exercise, what we do say to just reduce it down a bit in the first trimester. What we don't want is we just don't want your body temperature also to be getting high and staying high, like above 38 degrees. But yes, once you are pregnant, to just reduce that down slightly. But I mean, if you're doing a lot of exercise at the moment and you're getting regular periods and you're ovulating, then I think you can still carry on with that exercise at the moment. I wouldn't say that was too much. All right. But no, I talk a lot of this with my ladies with PCOS, and so I see a lot of women with PCOS, and I have a website, how to get pregnant with PCOS.com. Christina has got here, do women with PCOS have issues with uterine implantation? Thanks, Christina. Great question, and we touched on it briefly before about implantation and PCOS and IVF. What we do know about implantation, if you're ovulating and you've got an embryo and it's coming into the uterus, then your uterus should be fine for implantation. Occasionally, we might get someone with PCOS who have altered endometrium, and this is one of the symptoms of polycystic ovarian syndrome. It's not common, but it's where the endometrium in the uterus can undergo some pre-malignant changes and have precancer cells. Usually women would present with very heavy bleeding, and if you have these pre-malignant cells, then yes, that will affect implantation of an embryo. However, if it's just normal PCOS and you have an embryo going in, then no, that should not affect uterine implantation. Other things about PCOS that I mentioned was weight. So weight has a very important association with implantation. So have a look at your weight, but because if your weight is okay, then no, you should have no problem with implantation. Women who don't ovulate, such as PCOS women, when we put embryos in, if you're not ovulating, sometimes we would need to give you hormone replacement therapy to help the lining in your uterus for an embryo to implant. However, if you are ovulating, then yes, an embryo should implant. Amy just says, I have another question here. Amy, hi, Dr. Teirney. I'm getting a lot of targeted ads. Oh, yes, about inositol for PCOS at the moment. Oh, I hate all that nonsense. Is it actually helpful? Don't buy it. Okay, forget about it. Don't buy it. All you need to do is eat healthy, okay, and save your money. So the whole idea about inositol, it's very big in the USA and overseas, is that it may well help, with the ovarian environment and reducing insulin. But I think the fact that you're on letrozole, this is the first line treatment, all right? In all the medical literature, new evidence has come out now by a group of all the top fertility specialists and PCOS specialists, and they now have a cascade of treatment for PCOS women. Inositol, I can assure you, is nowhere in there. And the first line treatment after lifestyle management is in fact letrozole. So Amy, you're on the right medication and continue on that. And good luck, all right? Anthony has a question. Hi, Dr. Teirney. What foods are good to eat to help with fertility if you have PCOS and endometriosis? Yes, that's a really common question. I get every patient actually asks that, even those without endometriosis or PCOS. Well, firstly, most importantly, you need to make sure that you're actually taking folic acid. So that is a really important vitamin and nutrient to eat. And you do get it in food, and the sort of foods that have it are grains, have it, even milk, has fortified folic acid in it as well. But what folic acid does, it's an important vitamin B group that helps increase your folate levels, which are really important for your baby when you get pregnant. And if you have good folate levels, then you reduce the risk of getting what we call a neural tube defect in your baby, like spina bifida. So that's the first thing, Anthony, is make sure that you're taking a supplement with folic acid. And the sort of foods that you should be eating are really dense nutrient foods that are high in antioxidants. So leafy green vegetables, broccolini as well, broccoli, Brussels sprouts. These are really good foods to eat. Nuts are really another great food source for fertility, as well as they contain vitamin B, they contain zinc, and garlic is another one, and also tomatoes. So tomatoes are very rich in lycopene, which are also very good for fertility and male fertility as well. But don't miss on any of the food groups. You really do need to be eating all the main 5 food groups, which is, protein. So fish, which contain omega-3, salmon and sardines and tuna, are all very good for egg, we think, and for egg development and follicle development. Now, in terms of endometriosis, I haven't seen anywhere that there are specific foods for endometriosis. However, I think just having a good diet of what I've mentioned earlier would be very important. Now, I'm going to keep on scrolling down, ladies, and keep putting in your questions. They're all brilliant questions. They are. Perina has said, how do we know our egg is growing or not growing? I also have PCOS still, and they removed a dermoid cyst in 2013. Also, I'd counted my eggs. How do you know if your eggs are growing or not growing? Good question. So with polycystic ovarian syndrome, ladies, just to reassure you, normally, uh, you're all fertility goddesses, all right? I tell all my ladies that, and the reason is because women with PCOS have a higher number of eggs compared to other women their own age who don't have PCOS. And so you're not someone who's going to run out of eggs very shortly, like other women. In fact, many PCOS women can have high AMHs, and AMH is called anti-Mullerian hormone, which is your egg number, and you can go and have a blood test that will check how many eggs you sort of have in your ovary for your age. How do you know if they're growing at all? Well, the only way you'll know if they're growing is if you are having periods. If you're having a reasonably regular cycle, then we know that your egg is growing and ovulating in a regular fashion. If you have 4 periods a year, then that is suggesting that your egg is growing and developing 4 times a year and ovulating. So if you're not having any periods, then we know that your eggs, they're sitting there, but they're just not growing and ovulating. And if that's the scenario, then you would need medication or some form of fertility treatment to help your eggs to grow and then ovulate. So this is how what we know for natural growing and ovulation. However, when it comes to fertility treatment, when we grow eggs, we know they're growing because we actually track women in our clinic. So at IVF Australia, when I'm giving fertility treatment to my PCOS ladies, uh, we track them, and our nurses, we're doing blood tests and we scan, and we can tell if your egg is growing, and we can tell if you have ovulated. So there are certain techniques and special blood tests that we can do to see if they're growing. But Pruny, I think if you're getting periods and if you're getting regular periods, then we would be assuming that yes, your egg is growing and ovulating. If you're not getting any periods, then they're sitting there and they're not growing. Okay. Um, so I've also got a question. I want to be a single mother, but I don't know from where should I start. This is to all you single ladies out there. I see a lot of single women, and many women single women want to be mums. Okay, Mr. Right hasn't turned up, or there may be other scenarios in your life where you haven't had that opportunity yet to be a mum. And so what we offer at IVF Australia for all women, including PCOS women, is we do have a very large sperm donor program. And so if you're a single person, you're wanting to be pregnant, then certainly make an appointment, ring our 1-800 number and make an appointment with one of our doctors to talk about our sperm donor program. And we can actually help you get pregnant this way, whether it be with tablets to help you ovulate with donor and get pregnant with donor sperm, or do IVF with donor sperm to help you be a single mother. I hope that answers your question. But ring our 1-800 number. So if any of you ladies who are listening today, want some more advice or want to see one of our doctors, then certainly ring up the 1-800 number. I'm going to move on and answer some more questions. Christine, what are the causes of a failed cycle? Christine, I'm not quite sure what a failed cycle is for you. I don't know if that means did you not ovulate, or maybe you did but didn't get pregnant, or did you do IVF? And so firstly, just say what are the causes of a failed cycle. Just say if we give a woman letrozole, which are tablets to help induce ovulation for PCOS, just say if you don't ovulate, then of course that would be a failed cycle. And we know that the dose that we put you on is not high enough, and we'd need to increase the dose of letrozole to see if that would induce a better ovulation next month. If, however, you ovulated but didn't get pregnant, then don't lose hope. The chance of getting pregnant when we ovulate women and they have timed intercourse, or even when we ovulate them and do intrauterine insemination on them, the chance of getting pregnant with that cycle is about 20%. All right. And so and the reason for that is, the sperm and egg still have to meet. We're hoping that there's going to be fertilization, and there may not be fertilization. Other possibilities or causes might be that there is fertilization, but your embryo just may not be dividing properly and may not get to a blastocyst. Other factors may be there may be no implantation of the embryo. Or if there is, then it's a very early pregnancy and it goes on and dies. Another failed cycle would be where you might be doing IVF. So this is another scenario of a failed cycle, and sadly I've had to talk with two of my ladies today with IVF who had failed cycles, and here this is where we'd put embryos into their uterus and they didn't get pregnant. And you think, okay, what are the causes then? And that's the most common question for couples that are doing IVF. Why didn't I get pregnant? Why did my cycle fail? And look, there are many reasons. Most common reason would be, even though the embryo might look good, it might be a beautiful looking embryo and show all the right sort of aspects, there may still be something genetically wrong with the embryo, and therefore it will not implant into the uterus. And we think that's the most common cause for a failed cycle when it comes to IVF. Chances of a genetic abnormality in an embryo do increase as we get older as women. And we know that failed cycles are more likely over the age of 38 years. Other causes for failed cycles in IVF, so we're talking about IVF now, where an embryo hasn't implanted, is yes, there could be something wrong with the endometrium, and your doctor would be looking at that and checking for all those aspects. So checking to make sure there's no polyps or fibroids in the uterus, checking to make sure that there's no infection within the endometrium of your uterus, making sure you don't have any special autoimmune conditions that could reduce implantation of your embryo. So these would be other causes of failed cycles. But the most common reason is, in fact, the embryo. We know this based on many of the studies. I'll just move on for a little bit more. Let me just, I think, here we go. Oh, Amy, haha, thank you. Yes. Oh, lovely. Thank you. Oh, Mitch, someone's just said, thank you, Dr. Teirney, for your amazing treatment. Our daughter is about to turn 1. Brilliant. So, if your daughter's about to turn 1, just think about baby number 2, okay? And that's wonderful. Congratulations. Thank you for that. Now, I've got another question here. This is a really important question, actually. Thank you, Rachel, for asking this. Hi, having high insulin, can it cause implantation issues? Good question. We know that people who have high insulin, so you've got polycystic ovarian syndrome, and you've obviously been diagnosed with what we call insulin resistance. And so this is quite common in women with polycystic ovarian syndrome. And insulin is a very important hormone made by our pancreas, and it's there to help with glucose metabolism. And what we find with PCOS women is that their insulin is higher within the bloodstream, and therefore we know that these insulin levels can then go on and affect your ovary and the development of your egg, and reduce the incidence of ovulation. Now, can it affect implantation issues? The way it would affect implantation issues would only be if we know that when you're borderline diabetic, and we know that women who have diabetes have a higher chance, and this is with diabetes and also with being overweight. We know that there is a higher chance of miscarriage, which can be associated with implantation. So possibly, yes, high levels can, and so therefore being on metformin, which is an insulin lowering tablet, would certainly help if that's the case for you. We certainly know that being on metformin, the insulin lowering tablet, helps improve egg development. It helps improve egg quality. We know it also helps improve fertilization, and certainly I think, Rachel, discuss with your doctor if you are not taking this at the moment. Now, just ladies, just to give you all an idea about metformin, if you are not ovulating, it's worthwhile going on and having a blood test for insulin. We call it a fasting insulin and fasting glucose. And so speak to your doctors about this. And if you do have insulin resistance, then certainly it would be wise to get on to metformin. And metformin can certainly help lower those insulin levels. It may possibly help you ovulate, and studies have shown that it can help women ovulate in 10% of cases, as well as reduce, over a long period of time, things like acne and hirsutism. Now, I'm just going to go on and keep on going down the screen. Thank you. Christine's asked about assisted treatment injections. And Christine, I think you're talking about FSH injections. So remember I talked about that cascade. We have this whole new treatment cascade for PCOS women, and we've got whole new guidelines now. This is the new thing with PCOS. And when women are not getting pregnant on letrozole or Clomid, the next step in the cascade of fertility treatment is injections, and these are follicle stimulating injections. It is a great treatment option. The idea is that you're on daily injections for about 2 weeks. They act on your ovary, and they act directly on your eggs in your ovary to stimulate egg growth and to help you ovulate. We do this at Ivf Australia very frequently. It does involve quite close monitoring. So here at Ivf Australia, we'll be bringing you in quite frequently, very early in the morning before your work, and we'll be showing you how to use these injections. They look a little bit like, here we go, they look a little bit like a pen like this, and you just sort of inject them, a little bit like insulin into under your skin once a day. You'll need to come in and have close monitoring, as I mentioned before, and we'll be doing blood tests and scans on you. And this is the reason why we need to watch you closely. We need to watch you closely because we really only want one egg to develop and ovulate. We really don't want multiple eggs developing. We don't want to give you twins or triplets, and this is one of the risks of injections, Christine, when you go on to this medication. It is still a great treatment. The chance of getting pregnant each month on this treatment is about 20%. However, the chance of twins, just say if you get pregnant, the chance of twins is between 5 to 10%, all right, if you do get pregnant. So but it is still a lower cost treatment when compared to IVF. Amy says, what's the likelihood of being insulin resistant with PCOS? It really varies on the different populations. So it can be anywhere from 10% up to about 35%, Amy. So, no harm in getting tested for it. It's a blood test. You'd need to be fasted. Speak to your doctor about that, or come speak to us, and ring the 1-800 number. Colleen, thank you, Colleen. It's here. Hello, I have PCOS and endometriosis. I have a fairly regular cycle, so 28 to 32 days. That's very good each month. You're also using a period app, brilliant, and you're tracking your basal body temperature and ovulation symptoms. Yep, say good. But your bloods and your ovulation kits do not show ovulation. Okay, that's interesting. is normal. Also, any suggestion to find out about my ovulation dates? That's interesting. So, Colleen, and all you ladies just listening to this, if you have a regular cycle, all right, so if your cycles are regular, then you must be ovulating in a regular fashion. All right. So, Colin, you will be ovulating, and this is everyone else who's listening in tonight. For between a 28 to 32 day cycle, you will be ovulating anywhere from probably day 14 to about day 18 in your cycle. And so what we mean by that, day 1 is your first day of bleeding, everyone. So your first day of flow, not just spotting, but first day of flow, we call day 1. And so, Colin, you would be ovulating, when you count from day 1, you'd be ovulating around about day 14 to day 18. And I'd be recommending, certainly follow your period app, but I'd be recommending to my ladies to have sex on day 14, 16, and 18 anyway. All right, anyway. So you're tracking your basal body temperature, very good. And you are getting ovulation symptoms, is that right? So that's good. And the ovulation symptoms, this is also a really good education point for everyone who's listening. The sort of symptoms for ovulation would be sore breasts. So if you're getting sore breasts later on in your cycle, if you're getting a little bit of acne later on in your cycle, or a little bit of cramping later on in your cycle, then these are all signs of progesterone. And progesterone is the ovulation hormone that we pick up to see if you've ovulated. Now, I'm just looking here, Colin, that bloods do not show ovulation. So there's a possibility that maybe the blood test could have been done on the wrong day. So there is that possibility. And sometimes we need to do what's called serial blood tests. And sometimes I do this for my PCOS ladies, where I might do a blood test every sort of 4 to 5 days and just follow them through. But for any of you who are interested, we do have cycle tracking at IVF Australia. We do offer one free or one bulk billed cycle tracking, looking at hormones here at IVF Australia. And certainly I'd recommend, if you're interested, to come speak to us about that as well. But look, don't give up, Colleen. If everything else looks good, sperm looks good, I would be having sex, all right? Sex. Day 14, sex day 16, and sex day 18. And of course, any other time you feel like it, of course. So good luck. And this is just another recommendation for everyone who's listening. We recommend, so if we know you've got PCOS, but look, if you've been trying to get pregnant naturally, if you're under the age of 35, then certainly it's all fine to keep on trying naturally for a maximum of 12 months. But look, if nothing else is happening, come and see us or see one of our doctors. Get tested and make sure there are no other factors that could be preventing or stopping you from getting pregnant. However, if you're over the age of 35, then we recommend actually coming in sooner and being tested sooner. And the only reason is because of age, because whether you've got PCOS or not PCOS, the most common factor that stops women getting pregnant and reduces our chances is our age. And the older we get, the harder it is to conceive. So if you're, say, a 30-year-old lady, your chance of getting pregnant per month if you're ovulating would be in the order of about 20 to 25% per month. If you're, say, a 39-year-old woman, your chance of getting pregnant will be in the order of about 10% per month. And if you're 42 years of age, you're looking at a 5% chance of getting pregnant per month. And if you're 45 years of age, then your chance is 2% per month. So you can see it does reduce with age. So certainly, if you're concerned or you've been trying for a while, come and see us and let us help test you and make sure that we're not missing anything that could be reducing your odds of getting pregnant. Thank you, Christine. Hi, Francis. Let me just have a look. I've got a really good question here from Kerry. Kerry says, I was told at a younger age that obviously you had PCOS. And today I went to a gynecologist, and was obviously told that I no longer have it. Can it just go? I haven't fallen pregnant in 4 years, and so obviously you're 33, is that right? Um, I haven't, and the doctor says to go straight to IVF. Okay, that's interesting. All right. I suppose I'm not quite sure who you've been talking to, Kerry, or what your situation is. Look at um, often when it comes to a diagnosis of polycystic ovarian syndrome, so this is where it comes to the diagnosis. Now, the diagnosis has changed over time, and it could be when you were much younger, when you're a teenager, there was the very different diagnosis as what there is today, but this is what we know now for a diagnosis of polycystic ovarian syndrome. So have a think if this is you, and everyone else there listening tonight, understand about what the diagnosis is. So to have the diagnosis of polycystic ovarian syndrome, there are three aspects that are part of the diagnosis, and you need to have two of them. So you need to have two aspects or two criteria to have the diagnosis. Now, the first aspect or first criteria is you need to have an ultrasound that shows that you've got over 20 follicles in at least one ovary. So that's 20 follicles, all right? That's one criteria. The second criteria is you've got to have either a blood test that shows that your male hormones are raised. That's another criteria. Or that you're showing signs of male hormones that are raised. When I mean signs, remember I mentioned you may show signs of acne or hirsutism. So if you've got acne or hirsutism, or you have a blood test that shows raised male hormones, that's another criteria for the diagnosis of polycystic ovarian syndrome. And the third criteria is your periods. And the third criteria says if you're having infrequent periods or almost no periods or no periods at all, or what we call oligoamenorrhea or amenorrhea, then that is the third criteria. So I'll go over that again. An ultrasound showing polycystic ovaries in one ovary, a blood test showing increased male hormones or you've got signs of increased male hormones, and thirdly, having irregular periods or no periods at all. And what you need to have the diagnosis is you need to have two, okay, two of those criteria to have the diagnosis. So Kerry, if you've got two of those three criteria, then at the moment you've got PCOS. If you don't have two of those three criteria, then your gynecologist is right. You don't have PCOS. Now, saying that, you might still have something called polycystic ovaries, and this is where you don't have PCOS, but you might just have polycystic looking ovaries, and this is where you have lots of follicles in your ovary, and in fact 20% of women have a lot of follicles in their ovaries. So that's for like 1 in 5 women, and that might be your scenario. So that could be a possibility why you no longer have the diagnosis. I'm not sure. So have a look at that. Now, usually when I see women who have been trying for some time, especially 4 years, and haven't got pregnant, we usually think, is there something what's going on? There must be something quite major going on. And obviously we test for all the other factors such as male sperm. We're looking at the fallopian tubes. We're looking and checking for endometriosis. And also your age, Kerry, would be another factor. And reducing the odds of getting pregnant. I'm not quite sure why your doctor said to go straight to IVF. It could be that there could be a sperm factor, or Kerry, it could be your age. Certainly once women get to 38 and greater, there's just a shorter time frame left to conceive and be a mother. And sometimes, at the end of the day, we just want our patients to get pregnant, and we're looking what is the biggest bang, for your buck in terms of what's the highest chance of getting pregnant in one go. And certainly for everyone who's listening, IVF certainly is the quickest way to get pregnant. All right, ladies. So the ways to get pregnant with PCOS, there's tablets, all right, with letrozole and clomid, where we can induce ovulation. We've got injections, which is follicle stimulating hormone that can induce ovulation to get you pregnant. We can do this with intrauterine insemination as well to help you get pregnant. But the quickest way to get pregnant with PCOS is still IVF. All right, it's not perfect, but yes, that is the quickest way. And possibly, Kerry, that might be why your doctor suggested that. So pop back and see your doctor. It might be the best thing for you, and you need to be in discussion with him about what you would like to do and the best way to move forward. But I wish you all the best, all right, and good luck with everything. Now I'm going to move on. Let's have a look. We're going to be coming to a close very shortly. So let me have a look. I'm going to do one more question and then I'll wrap up if that's okay with everyone. So it's quite a long night. This is a question from Francis. Thank you, Francis. And I had a miscarriage 2 years ago and I can't get pregnant. And you can't get pregnant until now. Okay, I'm not quite sure if that means you weren't allowed to get pregnant until now or you've been having trouble. Your periods are regular and your husband's tests are all normal, which is very good. Any suggestions to help you get pregnant? Well, certainly, Francis, it depends also on your age. Okay, if you're under 35 and if you have PCOS, if you're not, your periods are regular, then certainly if your periods are regular, then you don't need to have any letrozole or clomid, and you certainly don't need to have any injections. I would be recommending certainly some further testing just to make sure with miscarriage, and possibly, I know your husband's sperm is fine, but there may be other issues. I would be checking your fallopian tubes also to make sure that your tubes are open. And if they are open, then the two next ways to help you get pregnant would be either intrauterine insemination, and this is where we track you, Francis. We track for when you're ovulating, and then we get your husband's sperm and we prepare it, and then we inseminate the sperm into your uterus right on ovulation. This is a very low-tech treatment. It's a very easy treatment to do. We monitor you very closely, and that's one treatment option to help you get pregnant. The final treatment option would be IVF, and this is where we will be giving you injections to grow your eggs and then taking your eggs out and fertilizing them in our laboratory with your husband's sperm to create embryos and putting your embryo in. So certainly the suggestions of the two ways to increase your chances of getting pregnant if you've been trying for a while would be intrauterine insemination or IVF. So I hope that helps. Well, look, ladies, I'm going to wrap it up. And gentlemen, if you're watching too, and thank you everyone for being on this Q&A tonight. It's been an absolute pleasure talking with you, and there's been some wonderful questions that you've asked tonight, and I really wish you all the best for the future in endeavours to being mothers and fathers. Now, look, if you would like to speak further or have further help, we do have a 1-800 number at IVF Australia. Get onto our website at ivfaustralia.com.au. Have a look around. There's a lot of great information there and information on PCOS. You can speak to our ladies at IVF Australia if you'd like to see one of our fertility specialists, or come and see me. I work in Alexandria here in Sydney. Also, if you want to, I have a website, howtogetpregnantwithpcos.com. Have a look at that. But I truly wish you all the best and all the luck in the world. So good night. I'm just going to end this now.